Hi guys, and welcome to this week's video. So in this week's video, we are going to discuss what it took to be approved for weight loss surgery, at least for me. So for me, I had two different categories I had to follow. One was my health insurance requirements, and then also my doctor's requirements, which you did hand in hand. So it kind of made it go by a little bit faster. Now, something to consider is every surgeon is going to have different requirements, every insurance is going to have different requirements, and these requirements might change. So these are just what was required of me before I could be approved for surgery. And again, they might also change person to person. I'm not sure. So these are my requirements that were mapped out for me. And just a little note, if I do look off to the side, I have my laptop here with everything so I can remember what the requirements were, because there were quite a few of them. So with that, let's start talking about the insurance requirements. So the first one is the longest requirement. This is going to be 6-month nutritional classes. For me, what we did is we met once a month virtually. We were in the middle of the pandemic, and they kind of discussed, what your eating would be like, how to focus on your eating, what to shop for in the grocery store, all that type of stuff. So some of it was kind of common knowledge, common sense stuff, I felt, but I do know that that's not the case for everyone. So I do see the benefit in having these classes. Sucked having 6 months of them. I thought it was going to be like this long period and I was never going to have surgery. But with all these other requirements that you have to do, it actually kind of made it go pretty quickly. And before I knew it, I was scheduled for surgery. So next requirement for health insurance is to stop smoking. For me, it wasn't an issue. I wasn't a smoker. But I want to bring it up because if you are a smoker, it is something to take into consideration that you might need to stop smoking before you can be approved for surgery. Next on the list is you had to do what's called wellness consults. You had to meet with a dietitian and a behavioral health specialist. These were actually a part of my surgeon's office, so it kind of made it easy. I think I actually met with them both in the same day. I meet with one and then I went and met with the next one. So it was really helpful to be that way. The next requirement was the psychological evaluation. And this is really important because you need to be cleared mentally for what is to come after your surgery, to make sure that you have the motivation and you have the ability mentally to do what is required of you after the surgery, because it is not easy, and you will find out in my next few videos talking about that. So psychological evaluation, I feel, was really important. Next requirement is you had to meet with your primary care physician to get a letter of recommendation that they did recommend the surgery for you, that they felt it would benefit your health. They also wanted 2 years of reported BMI. Not an issue. Every time you go to the doctor's office, they're going to take your weight. They have your BMI. That's not a hard requirement to meet. Not that bad. Lastly for me is the place that I had the surgery had to be what's called a center of excellence. Kind of annoying for me because I don't know where the disconnect was. They actually changed my hospital 3 times before they finally got me scheduled at the right hospital. A little frustration, but in the long run, whatever. I still had the surgery. It's not that big of a deal. That is everything that health insurance required. Again, kind of sounds like a lot, but it really isn't. Next, we're going to go into the surgeon's requirements. So for this, to start, we had to do a slew of tests and studies. So first, you had to have an abdominal ultrasound where they go in and they measure all of your organs. I think it took about an hour for me for them to actually get all of the measurements and adjustments and all of that fun stuff. Next, you had a chest x-ray. Simple, easy. Blood work, simple, easy. Next, you had to have an EKG, and then you had to have an EGD, which is an upper endoscopy. Which for me, luckily, I had both of those tests prior, like a few months or a year prior, which was in their time frame requirements, so I didn't have to do those all over again, which was awesome. And they also needed you to do a sleep study. So let's talk about that for a second, because that was kind of frustrating for me, not having the sleep study at all. That was fine, whatever. It was actually at home. They sent you this test where you hook up like a monitor to your chest and your finger and you sleep. It's an at-home sleep study. It really wasn't that bad. The annoying part was me is I apparently had very minor sleep apnea, which I never had issues with my sleep before, no disruptions, nothing like that. So to have sleep apnea was kind of surprising. And the doctor required or recommended I go on a CPAP machine. So I went on the CPAP machine, got the CPAP. I could not for the life of me get used to this machine. I tried different face masks, everything. I was, I tried. I really did try to get used to the CPAP machine. I think I had one night where I left the CPAP machine on all night. Other nights, I would leave it on for a few hours before I ended up ripping it off my face because I just couldn't do it. I think for me, a lot of it was my anxiety with the machine being on. It was something about that. I couldn't settle. I couldn't get my brain to stop so I could fall asleep with this machine on. So that was kind of frustrating. Fast forward to the day of surgery, and I'm talking to the anesthesiologist. Brought up the sleep apnea. He asked me what my score was. I told him I was a 9 and that I was on the CPAP machine, and all of that. And he was like, so you're on the CPAP machine. He's like, I have sleep apnea as well. I am at a 15 and I'm not on the machine. He's like, I don't understand why your doctor has you on the CPAP machine. He's like, I'm not on one. So with him saying that, kind of justified in my head why I really didn't need the CPAP machine. I didn't feel like it was necessary in the first place, but I was trying to follow my doctor's recommendations. So after surgery, I kind of kicked the machine to the curb. I was done with it. I couldn't sleep with it anyway. The way it worked for me is I kind of like rented the machine. So the company ended up coming and taking the machine when I was still recovering from surgery, which fine, take it. I don't want it. I didn't need it. But yeah, that was kind of my frustration with the sleep study. The final requirement that the surgeon had before approving for weight loss surgery is a pre-surgical diet. Now this is going to be different from everyone. For me, it was a 2-week diet, which consisted of all liquids except for one meal, and that one meal was lean meat and vegetables. And then 2 days before surgery, it was all liquids. You couldn't have anything to eat. Underestimated how mentally taxing it would be to be all liquids. You want to eat, you have the cravings. We're going through the surgery because we're overweight. We like food, we like to eat, like duh. But it was hard. And then seeing other people eat and you couldn't eat, it was mentally struggle. But you got through it. You had to do it. So what it is, and the reason behind the pre-surgery diet is it's called a liver shrinking diet. What it is your stomach is behind your liver. So in order for the surgeon to safely get to your stomach, they want to shrink your liver as much as possible to safely get to your stomach for the surgery. So there's a purpose behind the diet. It's just hard. It really is. But yeah, so that was everything that my insurance company required and my surgeon's office required. Again, it seems like a lot, but when you put them together and you have that 6-month nutrition plan that you have to get through and you fit in all these other doctor's appointments and testing and all of that, really makes that 6 months fly by. And it's not that bad. A lot of work, do it all over again, love it. So in my next video, I plan on discussing the actual surgery and probably about 3 months post-op is my plan for my next video. So I do hope that you will like and subscribe this video and also come back for more. And just like before, if you have any questions or comments, please leave them down below. I'm more than happy to answer any comments that I come across that I can answer. But yeah, I hope you will join me for my next video and subscribe. Bye guys!